Good afternoon, fellow. My name is Lewis. I'm going to be your physical therapist for today. So as per your script, it says that you come in with a little bit of neck pain. So I'm obviously here to help you get through all of that, get you back to where you were. So what I first want to do is I want to take you through what's called a cervical scan. What its job is to try and rule out some red flags, make sure that nothing severe or serious is going on, that we don't have to send you out to other doctors, look for other referrals. That way we can get you going and back to where you were prior to starting with us. So first, what we're going to do is we're just going to observe your posture, make sure everything looks okay, which it seems to be. Next, what I'm going to ask you to do is I'm going to ask you to go through a couple ranges of motion with your neck. You're going to mimic the motions that I do, and you're going to let me know if at any point in time the symptoms that brought you in here are reproduced. So what I want you to do is first I just want you to drop your chin towards your chest. Any pain with that? Drop it all the way down. Hold there. I'm going to apply a little bit of overpressure. Any pain? Relax a bit. Push back into my hand. Good. You're going to extend back. All the way. Good. Move forward just a bit. Push into my hand. Good. Next, what I want you to do is I want you to drop your right ear to your right shoulder. Apply some overpressure. Come back a bit. Push into my hand. Good. Other way. Drop back a bit. Into my hand. Good. I want you to look over this ear like you're checking your blind spot. Relax back. Push into my hand. Good. Other way. Rotate it again. Relax back. Push into my hand. Good. Next, from this position, what I'm going to do is I'm going to apply a little bit of compression down onto your head. I want you to let me know if it causes any symptoms. Good. Now duck your chin towards your chest. I'm going to do the same thing. Look up towards the sky a bit. I'm going to do the same thing, but a lot lighter. Good. Next, I'm going to try and lift your head almost off your shoulders. Let me know if that relieves any of the symptoms. Flexing here. Same thing. Extend. Same thing. Good. Okay. Next, what we're going to do is we're just going to check some key muscles. Just make sure that they're firing the right way, they're not fatiguing. So what I want you to do is I want you to shrug your shoulders up to your ears. I'm going to push down, hold it up. 1, 2, 3, 4, 5. Good. Next, I want you to come out like an airplane. Good. Hold it up. 1, 2, 3, 4, 5. Make a strong bicep. Don't let me pull it out. 2, 3, 4, 5. Don't let me push it in. 4, 5. Same thing on the left. 4, 5. Good. I want you to try and lift your wrists up. Don't let me pull the wrist down. 5. Same thing here. Thumbs up. Don't let me win the thumb war. Good. Spread your fingers out. Don't let me close your hand. Perfect. Next, we're going to check the shoulder. Make sure that the neck isn't affecting the shoulder as well. So what I want you to do is I want you to keep your hands at your sides. Try and pull your hands down towards the floor. I'm going to try and lift your arms up. Don't let me do so. Good. Again, shrug up. Don't let me push you down. Good. I want you to round your shoulders forward. Don't let me pull you back. Good. Now I want you to squeeze your shoulder blades together. Good. Don't let me push you forward. Perfect. Now we're going to check your reflexes, make sure that those are okay and not diminished.
Mm-hmm.
A little bit relaxed. Good. Good. Tricep. Good. Same thing on the left. There it is. Okay, so now that we did all our reflexes, now I just want to check and make sure that the central nervous system isn't involved. So we're going to do 3 quick tests to your hands.
Mm-hmm.
I'm just going to take your wrist. I'm going to try and bend it up. Good. Something on this side. Now I want you to let your hand just relax out in front. Kind of make like a C with your fingers. Let it relax.
Mm-hmm.
Let it relax. Let it relax. Good. Same thing here. Perfect. Next, I just want to make sure that there's no neural tension in your arm, so I'm going to have you lay on your back. I'm going to stabilize your shoulder down here. I'm going to rest your hand on my leg. I'm just going to bring you out. Let me know if you feel any tension coming across the arm.
Feel that?
A little bit. Good. Relax. I'm going to do the same thing on the other side. Stabilize down. Rest the arm on my hand. If I wanted to accentuate any of these symptoms, I would have him side bend away from the arm that I'm using. So if I feel stress here, I would have him side bend towards his left. If that increased his symptoms, I would know that there might be an indication of neural tension. Okay, Paolo, seems like everything's okay. No red flags are indicated, no severe signs, so we can move along with our treatment.
Mm-hmm.